So how does spinal decompression work? So spinal decompression is achieved by using a specific combination of force of pull, angle and degree of pull, and varying time in order to create a negative pressure that creates a vacuum inside the disc that helps to draw in the bulging disc and extruded disc material back into place. So that in turn takes pressure off pinched or irritated nerves, and that's where the pain would be coming from. So spinal experts like myself believe that nutrients, oxygen, and fluids are drawn into the disc to create a sort of revitalized environment conducive to healing for both herniated and degenerated discs. So based on the patient's body weight, tolerance and level of severity, and durations of symptoms, your spinal decompression specialist will determine a specific treatment plan based on your individual needs. So everything is done very specifically tailored to you. It's not a one-size-fits-all. This helps ensure the best and longest lasting results is what we commonly will see with someone. So here's to give you an idea too, some visual aids. Stages of spinal degeneration. So understand when you have degeneration in the spine, a lot of times doctors will say, oh, you have degeneration, you're over 40, so of course we're going to see that. And that's not uncommon to see, but that doesn't make it normal, does it? And it also doesn't make your spine healthy to have faster rates of degeneration in certain areas. So you can kind of see here, it gives you a good idea of the normal cervical spine here and the normal lumbar spine. You see how there's a nice little C-shaped curve here, a little curve there? Well, this is considered more normal. We have good healthy disc space, as you can kind of see through that little hole. That's the disc, the dark part, and then you get the little disc space right here. You get their little, the neural foramina between the vertebra here that allows the nerves to exit freely without interference, okay? Same thing here, lumbar. Good healthy space at number 2. If you can see that, number 2, nice healthy disc space. 3, that's where that nerve, you can see right here, it's kind of what you're looking at, right? The dark space is the red space on this model. So what you're seeing here is a nice healthy space for that nerve right here, that little yellow nerve, to come out. Now, when you get more pressure in here over time, and then even a herniation, you can see how that would irritate the nerve. Now, if you just had degenerative disc, what you would see, without an MRI, if you just had an X-ray, you can see the disc space in here is degenerated, right? But you can't tell if there's an actual herniation. You can't tell if this is happening. You can't tell if there's a disc bulge or herniation, protrusion. You can't tell that without an MRI. So that kind of just confirms what the neuroorthopedic exam would also kind of make us think what's happening in here, okay, mechanistically. So what happens is stage 1, you can start to see, we're getting a little bit more degeneration there. You can see there's less space. So again, this is kind of showing that there's a little bit less space in here, right? A little bit less space in that disc, a little bit less space for that nerve to come out of that little foramen. So then you get into stage 2. Stage 2, now you're starting to get some bony changes at the actual vertebral bodies. Now you're starting to see, oh man, we don't have hardly any space in some of these disc areas, okay? You guys can see that, okay? See how there's way less space? Then you start getting like these Homer Simpson lips. Even more dramatic here on stage 3. You can start to see how we have loss of space. So when you have loss of space of the disc, and all these segments stack up, you start to lose that curve. So it starts to become more like rigid, straight curve, or even kyphotic, which means it starts to kind of reverse because you're getting collapsed, basically disc, and you're not getting that good little springy C shape that we want, okay? So the bones have to adapt to those force loads for which the loads are from the gravity, from how you're moving, your postures, all that stuff is going to create even more compression. And so some of these areas are going to be worse than others. But what we commonly see here, obviously, is going to be, that lower lumbar spine and kind of that mid to lower cervical area. Those are the common areas that we would see. So hopefully that's kind of helpful for you guys. And, I'm going to go over some more details on how the table works and all of that to make you feel a little bit more comfortable before you come in and understand what it is we're trying to do, because what we're not trying to do is mask your symptoms. And in fact, some people will report feeling a little sore when they first do this stuff. It's like if you go to work out and you haven't worked out a certain body part in a while, you're going to be sore. That's normal. You should have some kind of adaptation process where you feel sore. And so, depending on how long you've had these problems, it can take a little while. So 4 to 6 weeks isn't very long when we put someone on a trial of this kind of thing. And to speed that process up, to make it even more comfortable, we use things like laser, electrical stimulation, maybe some mild adjustments here or there, some muscle work. There's certain things that we can do manually as well to help alleviate some of the symptoms that would maybe kind of happen as you kind of progress. Other people, if it hasn't been going on that long, sometimes it's just immediate relief. Like the first time you do it, you just feel immediate relief from the decompression of that area that's being compressed. And just remember, a lot of times when these pills and injections and acupuncture, all these things that you do are not working, that usually means, again, based on your imaging, your MRI, it's very easy to tell, like you need decompression. You need to structurally open that space up to relieve the pressure in there so you can actually get some healing. And if you have nerve pressure, you're absolutely going to have pain that's not going to be completely lifted by an injection of, steroids or even, acupuncture needles or even chiropractic adjustments. And if I can go on one more little tangent, because it's kind of pertinent, the reason why a lot of times regular chiropractic adjustments, especially the kind where you're on the table and you kind of get on your side and you get the side posture adjustment into this area, a lot of times what's happening is that's not the right type of treatment for the disc, because they need to open up this way. Sometimes it can be helpful, but it just depends on what kind of herniation you have going on. If there is, it sometimes can aggravate it. So those of you that have maybe been to a regular chiropractic adjustment and you've noticed that it got flared up, that just kind of confirms that's most likely a herniation. And the adjustments work really well, just FYI, if it's more of these facets. A lot of times these little, I can kind of show you, these little guys right here, these little facets, we almost dropped it. So there's certain types of where adjustments can actually be helpful. But when it's an actual disc issue, decompression tends to be the best thing for that.